recording the class. Okay. Can you see my screen now? Is it clear? Yes. As you know, girls, this class will be integration between English, health, and science. In our lesson today, we are going to introduce one of the presentations that is related in two subjects, English and relates to health and science. It's like a talk show that is going to be presented by three of my students, Rawan, Dala, and Basma. But before starting, girls, I would like one of you to introduce the rules of the distance learning that every day we have to remember them. Who is ready, girls?
Me, teacher.
Yes, Haneen.
The online rules, you have to sit in a quiet place, no drinking, no eating, be a positive attitude by raising your hand, don't mute your mic just when teacher tell you, and if you have pets, don't put them in the same room.
Yes, thank you, Haneen. And what I need from all of you girls, yes, what I need from all of you to show me your positive attitude. How can we show positive attitude, girls? By muting your amounts, unmute your amounts until your teacher or one of the girls who are going to introduce their presentation allow you. Okay? Before we start, girls, the girls of the group, Dala, Rawan, and Basma, here is the rubric that I have sent to you. You will be evaluated according to the rubric. Okay, I think I have sent the rubric by WhatsApp yesterday, and it's also available on LMS. You will get 0 out of 10 on the presentation if you have done none of them, if you didn't show pictures, if you didn't use medical terminology. 2 points if you achieve or completed one of the following. I think you have read all of them. Okay, if you completed the 5 elements, each element equals 2 marks. Presented clearly, using medical terminology, your work was accurate and use appropriate images. Ready, girls?
Ready.
Thank you. Also, the rubric, I have sent the rubric for all of you girls in order to evaluate your presentation today. Okay? I will stop sharing my screen to see my doctors. Before you start, girls, my dear girls, today it will be special. I will take you on a journey to Dala Healthcare Program. It's her talk show. As we know that the goal of the first aid is to save lives, to prevent illness, and to help speed recovery. Learning first aid skills is not only for the medical professionals, it's also all of us need for these skills. All of us need to learn first aids. That's why we are with Dala today. Hi, Dala.
Hi, Ms. Nrmeen. Good morning to you.
What's new in your program for us today?
Today, our topic will be about first aid, and I will be introducing two doctors who will be giving us the feed for today. Introduce yourselves, Dr. Rawan and Dr. Basma.
Hi everyone, I'm Dr. Rawan Kadera. I'm excited to be here with you today. We are going to learn about first aid, about emergencies, how to call 998 operator, and many more. Stay tuned.
Okay, thank you. Dr. Basma.
Good morning, everyone. I am Dr. Basma. Today, we will discuss with you about first aid.
Okay. Dr. Basma, can you give us a major background about first aid?
Sure. Well, first aid is when you provide basic medical care to injured or a sick person by the first aid kit. Also, first aid is all that's needed to treat minor medical cases, so it's very easy, very short.
So what contains in the first aid kit?
Well, first of all, you should know that you might need a first aid kit.
Basma,
Yes.
try to change the slides to show us the content of your first aid. Thank you, and try to open your cameras, girls. Rawan and Basma. Yes.
I'm opening my camera.
But we cannot see it. Girls, can you see her camera?
Me?
Yes, Basma, now it's clear. I think, Rawan, you need to reopen your camera. Yes, Basma?
Okay. You never know when you might need a first aid kit, so you always have to be prepared and have one in your home or your work or your car. Also, first aid kit, you can buy it from a pharmacist, or you can create your own by buying products from a pharmacist. The tools you need for a first aid kit is very simple. It is bandages of assorted sizes, aspirin, scissors, sterile gas baths, Meebo, tweezers. These the most important product in my opinion. I want to ask you girls, what's your opinion about these tools, product? Which one is the most important in your opinion?
The question is forward for you, girls. Which items you think most important to be available in first aid kit? Yes, Sima?
Bandages.
Yes, bandage. Thank you, Sima. This is the most important one. It must be available in first aid. Yeah. And can I participate, girls?
Yes.
Yes, sure.
Okay. From my own point of view, I think plasters, bandage, as Sima said. Yes, Haneen?
I think bandages and blasters and sterile.
Yeah, exactly. And auto injection for the people who suffer from allergy. I think also it's very important.
Yes.
Yes, okay, thank you.
Well done,
Thank
Dr.
you.
Basma. I think Dr. Rawan should now tell us about the emergency number in the UAE.
Yes, in UAE we have the number 998 for medical care units. But actually, if you forget the number, it's not a problem at all. You just can remember the number 999 for any emergency unit in the UAE. And now I'm going to share you how to call 998 emergency units. Yes. How to talk with a 998 operator. First thing, you should be calm. Try to be calm. Don't be panicked. Don't be stressed. Answer all the questions properly, briefly, and with facts. Don't try to argue with 998 operator. Don't call them if you don't have a real emergency situation. And now for answering the questions of the 998 operator, we have something that's called 4W rule. What is 4W rule? Is something called where, what, when, who. Where stands for the place. You should give the operator the correct place and exact place. What, explanation briefly and with facts. When, you should note the time, when does that happen. Who, if someone was intervened with this accident or something, you should mention this for sure. Okay, all of us know that, as I said, you shouldn't call the 998 operator if you don't have any emergency or unnecessarily. Yes.
So, Dr. Rawan, why it is important to give details about the case to the operator?
Because actually, when you explain everything with facts and details, the operator may send you a specialist doctor and a special ambulance to your situation.
Thank you, Dr. Rawan, for such an amazing information. Let's turn to Dr. Basma. What should we do if we face an emergency situation?
Dr. Basma?
Wait, let me share my screen. Okay.
Have you prepared anything for us today, Dr. Basma? If we would like to intervene and introduce, special medical help?
Yes, sure. I prepared. Okay. So, step 1, you should check the scene for danger. For your safety, please, guys, before you interrupt the medical scene, please check if the area is safe for you. If it's not safe for you, please leave the area, then call for help. Step 2, call for medical help if needed. If you suspect the injured person, if you see an injured person or sick person, you should go comfort them. Then tell someone nearby to call an ambulance or an operator. If you were on your own, you should call by yourself. Okay. Step 3, provide care. If you can do safely, protect the injured person till the professional medical to come, you have to protect them. You have to keep them calm till the professional medical come. If you can't keep them safe and the area is dangerous for you, you must leave the area. Then call someone.
Yes, exactly.
What?
Not allowed to interfere if you think or doubt that the area is
Yes.
not safe. Yes, perfect.
You have to protect yourself. If you can't protect yourself, please don't interrupt, because we will have 2 cases. Okay?
Yes, instead of one case, and you are going to offer help, we will have 2 cases. Yes, thank you, Dr. Basma.
Exactly.
Thank you, Dr. Basma. I think now Dr. Rawan can give us further information.
Yes, for sure. I'll share my screen. Yes. As all of us know that we have a lot of emergencies to deal with in first aid, but I'll just talk briefly about 3 of them. First emergency we have is bleeding, heavy bleeding. Of course, we know that there's 2 types of bleeding, severe and minor bleeding. And the most important is that heavy or severe bleeding. So let's talk about it. How to interact with a heavy bleeding? You just have apply pressure using a cloth or a cotton to soak up the bleeding. Hold on to the injured part until the bleeding stops with using a cotton or a cloth. Okay, and if the bleeding didn't stop, you can simply call 998 for further medical help. Okay. Second emergency we have today is heart attack. It's everyone knows what is heart attack, I think. How to handle or how to interact with heart attack? First thing you should do is call the 998 immediately right away. Second thing, try to find a comfortable place for this person to lay on so he can be relaxed or like this. And check for the pulse rate, for breathing, for the airway. If there's no pulse rate, you can start doing CPR until further medical help arrives.
Arrives, yes.
Yes. Now we will talk about the CPR. How to interact with the CPR. Of course, we know that CPR is an emergency procedure that can help save lives in their breathing or heart stops. Okay, so what should we do in CPR? First thing, you should call the 998 for further medical help. Second step, and start by giving CPR by putting one hand on the other. Then at the center of the chest, using your body weight, start giving 30 pressuring, 30 pushes, and 2 breathes. Okay, and do this until the more medical help arrives. And yes, that was my emergencies today. I hope you have a lot of questions about it. So yes, thank you.
So, Dr. Rawan, you think these steps certainly save a life?
Actually, of course, yes, because these steps can treat the patient very well.
Okay, but it's also important to protect ourselves too, and I think Dr. Basma will explain that.
Okay. As Dr. Rawan said, there is a way to protect ourselves while helping others. It's very simple. You just have to be sterilized, wearing gloves. Also, you should check the area before you provide any medical help. It's very important to be safe and protect yourself before interrupting or helping others. Because if you didn't protect yourself, there will be two medical cases, and that will just make it worse. So you have to protect yourself before helping others. You just have to be sterilized, wearing gloves, just avoid any body fluids that could harm you.
Okay, thank you, doctors. Let's turn now to Ms. Nrmeen to receive questions from grade 11 girls.
Yes, thank you, Dala. Thank you, Dr. Rawan and Dr. Basma. Waiting the girls' questions. Girls, we are waiting your questions. If you would like to ask any one of the doctors about any skills of the first aid. Who wants to start? We open the discussions, girls. If you would like to ask one of the doctors, I will forward your questions directly to Dala, and Dala is going to forward the questions to the two doctors. Yes, Asma, let's start by Asma.
Okay, I want to ask one question is what I can do if I don't have a first aid at the scene of an accident.
I
Dr.
think
Dala.
this question is forward to Basma.
Okay.
I think you can use basic products. Like if you have to be sterilized before you can do anything. Maybe if you don't have, you should wash your hands before helping any injured or sick person. If you can't help them, you can calm them and call the professional medical help. You can call them, then keep an eye of the injured person. If you can't do any of these and you are scared for yourself, just protect yourself, keep an eye of the injured person from far away, and call for help.
Yes, thank you so much.
Yes, you're welcome. Thank you, Dr. Basma. Okay, let's turn to Sima. Would like to ask a question? Yes, Sima?
Yes, how many times can we do CPR?
Yes, how many times? She is explaining, she is asking Dr. Rawan, I think this question will be forward for you.
Yes, actually you'll do CPR for 100 till to 120 pushes until further medical help arrives.
Okay, it will be, Dr. Rawan, can I interfere and ask you questions? The number of pressures will be equally exactly for the same all ages. For example, if your casualty is an old person or adult
Adults
person.
and children, nearly they are the same, but for newborn babies, it is different.
Yes, thank you, doctor. Another question from Miss Haneen.
Yes, my question is for Dr. Rawan. What do I do if I found a person unconscious and I can't wake up him? There's steps I have to do it or call the emergency?
You'll do CPR in one step if they are not breathing. A cardiac arrest happens, the heart stops. But for unconscious person, firstly call the ambulance 998 operator, okay, and check the airway if it's open or not. Check the pulse rate. These things are very important.
Okay, there is something I can't do it after they come, the emergency.
When you ask when you call the operator, he will tell you what should you do. When you answer his all questions, he will tell you.
Okay, thank you, Doctor.
Yes, Dr. Rawan, can I interfere in this point?
Yes,
As
sure.
Dr. Rawan said, I think, girls, it's very important to write down every single step, every single information you have not said when you are near to your casualty, because you have to be ready to be asked from the medical professionals when they arrive to the casualty. You have to tell them honestly what exactly happened. Timing is very important, and timing also can lead to survive many cases, girls, especially in the cases of stroke, bleeding, and heart attack. That's true, Dr. Rawan?
Yes, exactly.
Yes, thank you, Dr. Rawan. Let's turn to who wants to answer, to ask any questions, girls? Who is ready? Aya Ihab, you asked it? Yes, Aya Ihab.
What are the signs of heart attack?
There are a lot of signs, but mainly we can say feeling dizzy, shortness of breath, chest discomfort, sometimes vomiting, like this. But the mainly is chest discomfort and pain in the chest.
Can I ask another question, Dr. Rawan?
Yes, sure. Sure.
It's allowed, yes, I'm so sorry. It's allowed to start CPR directly if you feel that or you suspect your casualty needs CPR and he is passing heart attack.
Yes, if you found that normally in the heart attack, the person will be conscious. But if the person was unconscious and not breathing, cardiac arrest happens, the heart stops. So in this way, yes, sure, start doing the CPR.
Yes, thank you, doctor. Anybody else, girls? I think Sima raised her hands again.
Yes.
Yeah.
About the people who faint and not breathing well. So the CPR for them be different from other people or not?
About which case, Sima?
The people who faint and not breathing well.
Yeah, the people who are not breathing well. You think, Dr. Rawan, it's allowed to start CPR for them?
If they are not breathing, of course, you start CPR. But actually, most of the patients, they breathe well. But if not, start CPR.
How can we discover that they are not breathing perfectly or normally, Dr. Rawan?
Yes, very good question. You can listen for their breathing. You can listen if they are breathing or not. Check the pulse rate and from the neck. Okay. If they are not breathing, you can open their airway by putting one hand on the forehead and two fingers on the chin, raising them up.
Yes,
Dr. Rawan, I think also you can know by putting your hands in front of their mouth.
Yes, exactly.
Is it true? If they breathe normally, you will find the flow of air can normally get out from their mouth. Yeah, and also you can replace. Yeah, Riham, I think Riham would like to ask a question. Yes, Dr. Riham wants to ask a question. Your colleague. Yes, Riham.
I want to ask Basma.
Yes,
At what time should we stop doing CPR?
Have you heard the question, Basma? Dr. Basma, maybe we lost the connect. Yes, Basma, have you heard the question from Riham?
When we can stop the CPR?
Yeah.
Yes.
I think this question not for me. It's for Dr. Rawan.
Yes, because Dr. Rawan today, who is the person who is responsible for the emergency cases, but because Riham is your close friend, she would like to forward the question for you. Yes, Dr. Rawan, I think simply, Dr. Rawan, yes.
You'll not stop doing CPR only in two cases: if the medical help arrives or you found that this casualty starts to respond to you and pumps blood normally without your help.
Yes. Okay, thank you, Dr. Rawan. Another questions, girls? Do you have any other questions? Yes, Lujain?
What do I do if someone is bleeding in front of me? How do I stop the bleeding?
Yes, if you have a bleeding, you can apply a pressure to the injury using a cloth or a cotton to the injury. Keep pressing on it until the bleeding stops and call the emergency if the bleeding didn't stop. But if you have a tourniquet, you can have a tourniquet, put it 4 to 5 centimeters above the injury. It will stop the bleeding normally. But just remember one thing, you should remove the tourniquet to around of 30 minutes so the tissues don't die.
And the place also of the bandage and the dressing should be before the injury, 5 centimeters at least, in order not to harm the arteries or the vein that causes bleeding. Rufaida would like to ask a question. Rufaida?
Yes, my question is how we can act in an emergency in cases of poisoning.
Poisoning. Poisoning.
Yes, in case of poisoning,
I know.
Yes. In case of poisoning, the most thing that you need is getting a lot of information about what happened. What was the poison thing? If she had poisoned from food poisoning, acid poisoning, chemical poisoning, you need to collect a lot of information about it to call the emergency and say to them what happened.
Yes, thank you.
Yes.
Thank you so much. Safiya would like to ask a question. Yes, Safiya.
What is the pros and cons of CPR?
What are what? Excuse me, can you repeat your question again?
What's the pros and cons of CPR?
Yes.
What is, yeah.
The advantages and disadvantages. Actually, the advantage of CPR that it can survive the person's life, okay? Survive him, yes. But the only disadvantage is that while you are doing the CPR or the pressures, this 30 pressures, you may by mistake break a bone in the chest or something, but actually it's not a big deal because it will not move from its place. It will not affect any other thing. They can treat it when the casualty goes to the hospital.
Okay, excuse me, Dr. Rawan, I would like to say something about CPR. Never start CPR, girls, unless you receive extensive training on CPR. It's very important. Yeah, because the number of pressures...
Miss Nrmin, what I've studied of how we can behave in dangerous situations like this, it can really affect the person who's doing CPR too. He have to be very calm to can do CPR.
Yeah, and they have certain professions of setting and exact numbers of pressures and in specific place on the chest. So you have to be careful. Not everyone is able to do the CPR. Yes, thank you, Basma, Dr. Basma, sorry, and Dr. Rawan. I think we are allowed, girls, to ask 2 questions more because we have to write our exit cards and give the girls the chance to evaluate their work. Kauthar? Yes, Kauthar?
My question to Dr. Rawan. What should I do if I find someone injured while my phone is not with me to ask for help?
Good question. Actually, if you don't have your phone near you, just shout for help. Like shout for anyone that can call for you the emergency, and start by checking the pulse rate and the airway breathing of this casualty. And as we said, if there's not breathing or no pulse rate, start doing CPR.
Yes, thank you, Dr. An. Enough answer of this question. Let's take another question from Farah. Farah.
Yes, how should I behave in the event of external bleeding and I do not have a first aid kit?
External bleeding?
This question is for Basma.
First aid kit. Very excellent question. Yes, external.
Can you repeat your question? I didn't hear.
Yes.
How should I behave in the event of external bleeding and I do not have a first aid kit?
I think you have to call an operator. You have to call a professional medical help because you don't know how to behave and this out of your control. So you have to call a professional because if you behave from yourself, it could go way worse.
Yeah, I think there's another way, Dr. Basma.
I do also have an answer.
Yeah. Calling interventions or medical interventions. This is in all emergency cases, girls. But if you don't have first aid kit, it's not available nearby you. You can use any items around you. You can take off your scarf and tie it around the injury and start the first aid. Okay. So you have to look around you to find anything that can be very helpful in this case. Okay, thank you.
Yes, but you have to be sterilized. You have to wash your hands or even wear gloves. If you don't have gloves, maybe put a scarf around your hand because maybe your hand isn't clean.
Yes, exactly. Also, maybe the blood from the external bleeding is not pure or infection. It has any infection. You will harm yourself if you don't wear gloves. Yes, excellent, Dr. Basma. I forget about the gloves. Thank you so much.
Ms. Nrmin?
Yes, Ms. Dana.
I have a question to Basma, the Dr. Basma.
Yes. And this is, girls, it will be the last question because we have 2 tasks remain. We have to write what we have learned about first aid training today from our doctors, and my doctors are going to evaluate themselves firstly before receiving my evaluation from the rubric, okay? Yes, Dala, ask Dr. Basma.
Dr. Basma, do you think that in every house should have a first aid kit? Why it is important?
Yes, I think it's very important to have a first aid kit in your home, not just your home, also your work and your car. You don't know what when you don't know if you are in a dangerous situation. You have to be prepared. It's very important to be safe all of the time, especially when you are out of your home, maybe in school. Maybe you have to be prepared. Maybe someone hit her head or very harsh bleeding. You have to always be prepared for dangerous situations, so you have to have first aid kit. Also, you can buy them from pharmacy, or you can create your own.
Thank you,
Dr. Yes, special thanks for my doctors, Dr. Rawan and Dr. Basma. You read too much about the skills of first aid. You amazed me really with your enough information about the skills of first aid. Thank you for my program introducer, Miss Dala. I hope to be very famous program introducer in the future, inshallah. Now the questions, yes, you're welcome. Special thanks for the girls who gave us valuable questions. And now, girls, let's turn to the last step. Girls, you will evaluate yourselves according to the rubric, okay? You have 5 columns. You evaluate yourself first, and after that, you are going to receive my evaluation. Okay, girls, thank you so much. Now let's go to the last stage. Okay, and our exit card for today. In the chatting area, girls, I left something for all of you. For all of you girls, you will find Padlet. Have you found the link or not, girls? Or not yet? You will find the Padlet, girls. Press the Padlet, and I will share my screen. I will share my screen now. Every one of you girls, have you seen the Padlet page now? Yes, you will find the exit card questions. Write one skill you have learned today about first aid from your friends, from your class colleagues. Only one skill. Please don't forget to write your names, girls. Asma, Haneen, Sema, Dana. You also, Rawan, Dr. Basma, Miss Dala, excuse me. Try to log in Padlet and write what have you learned from your extensive reading about the skills of first aid.
Yes, sure.
I have learned about CPR. Sima would like to tell you girls that she has learned about CPR skills and heart attack. Marwa, remember girls, just only one skill, okay? Girls, while you are writing, Dr. Wadia would like to thank you for your presentation for today. Dr. Wadia, can you hear us? Dr. Wadia, you still with us? Girls, Dr. Wadia wrote for you that thank you for your presentation. He would like to thank you. Dr. Wadia, if you would like to share us with, press the link and write what have you learned from the training we received today from our doctors. Lujain, what have you learned, Lujain? Okay, before helping us.
Teacher,
yes?
just one skill?
Yeah, I think it's enough because I would like to give the girls the chance to write what they have learned.
Okay, teacher.
Yes. I know that we heard too much information today, girls, about first aid. For example, girls, Asma learned be confident to help others. Yes, perfect, Asma. Sema learned a lot about CPR and heart attack. Marwa, where are you, Marwa? You disappeared. No. Marwa, she learned how to do the CPR in an emergency situation. Yes, Lujain, she learned that if someone was in danger situation, I think you would like to write that. Yes, girls, until you receive your friends' feedback, I would like you to evaluate yourself. Rawan, how do you find your presentation today? Have you introduced the topic in a perfect way?
Actually, I hope that I introduced it in a perfect way. I wasn't stressed. I was calm while I was explaining.
Yeah. Do you think that the training that you trained was well enough to introduce further presentations in the future?
Yes, of course, because actually I didn't have only one course. I have two courses, and I have also read a lot of information about first aid from a lot of sites to improve my knowledge about first aid.
Yes, perfect. One thing you have learned about presentation skills, not first aid.
Yes.
Now we have you gain information about first aid. But what I want from you to tell all of us what you have learned about presentations. Which new skills you gain to introduce further presentations in the future?
First thing is to be calm. If you are calm and not stressed, you will introduce the perfect presentation. Be confident while you are talking. If one word or one sentence dropped from you, I collect myself again. I just don't stop a lot. Try to explain everything briefly and with facts also. Yes, I think this.
Okay. Do you think you have used the medical terminology in your presentation?
Yes. Yes, I think I have used.
Can you mention two of them?
For while I was explaining for the emergencies about CPR and heart attack, about these things.
Yes, thank you, Rawan. Thank you, doctor. I hope to see you, doctor, in the future. And don't give up this dream, please. Okay, thank you.
Yes. Thank you.
Now you can turn off your cam. Thank you so much. Dr. Basma?
Yes.
Dr. Basma, have you used the medical terminology in your presentation?
Of course I did, and actually I learned about a lot of new informations about presentations. I think it's harder than you thought.
Yes, thank you. If I ask you to evaluate your performance today in your presentation out of 10, according to your fluency, using of medical terminology in your presentation, how many marks you will give to yourself?
From what? From what grade?
Out of 10. Oral presentation is equal of 10.
Out of 10?
Yeah.
I think
divide the 10 into categories.
I think it's 8.5.
8.5. Why you lost 1.5 marks?
Because I am not wearing doctor's uniform. Because I was a little bit stressed.
Yes, thank you, Basma. Thank you, Dr. Basma.
Thank
you, Dala. Let's read the girls' feedback. I learned from you girls the signs of the heart attacks. Yes, and also stroke girls. Fast, the word fast, F-A-S-T. Who can tell me, girls, fast is a short form for what? Fast in brain stroke, for example. It's short form for what? Fast, F-A-S-T.
Can I answer?
Yes, F for?
Yeah, F for face, A arm, S speech, T time. FAST stands for fast stroke test.
Yes, thank you.
Okay.
And Sema learned CPR. Riham, she learned about if we have injured persons bleeding and you don't have the first aid kit, you can put a scarf around the victim to stop it. Thank you, Riham. Thank you, Sema. Rufaida, I learned the first aid is so important and it's a skills for all. As I told you at the beginning of the class, girls, it was our learning objective for today to learn how to give first aid in a professional way and to know that, girls, to have a deep feeling that it's our responsibility and it's not only exclusive for medical professionals. All of us, we must learn skills of first aid. Yes, Haya, she learned a lot of things about first aid. Okay, for example, first aid kit should be available in our houses. Yes, excellent, Haya Lujain. How to help injured and calm down them until they arrive. Yes, thank you, Lujain. Hanin, helping others, before helping others, protect yourself. This is the first rule of the first aid. Okay, and Basma, importance of first aid kit, because it was your turn today in your presentation, Basma. Kauthar, to behave if I come to see someone injured. Yes, how to behave. How will be our reaction? Yes. Aya, Liari, the signs of heart attack, and Sema, she introduced the first aid kit for you girls as a gift, I think. Salma, we must put what, Salma? Please complete your sentence. Maymuna, I learned that helping others is an important task for all. It's not only exclusive, as I told you, for medical professionals. Yes. Thank you, girls. Thank you for all the girls who participated with us today. Special thanks for the girls who were with me yesterday and today to prepare to this amazing presentation. Thank you for the valuable information you introduced to me. Thank you, girls. See you tomorrow. If you have any questions, you can chat me. Okay? And I'm going to read the rest of your feedbacks on the Padlet. Thank you, girls.
Thank you, teacher.
Bye-bye.
Thank you. Thank you, my doctors, my future doctors. As I told you, girls, if you have any questions, you can write in the chatting area and your teacher will be available all the day. Thank you. Sema, would you like to say anything before I leave? Okay. Nothing. Thank you, girls.